The devil's been busy in your backyard.
Oh, yes. For the past 4 years, we've had the devil right in our backyard. Welcome back to 21st Century Radio. I'm your host, Dr. Bob Hieronimus. Our executive producer, research assistant is Laura Kortner, and our engineer is Anita Brockington. Our guest this hour is Dr. Joel D. Meshulam, MD, here to talk about cannabis as a medicine, the endocannabinoid system, and the many conditions for which CBD and medical cannabis can be viable medicine options. Now, this isn't the first time we've talked about cannabis as a medical option on 21st Century Radio. As far back as 1996, we began interviewing experts in this field, starting with our dear friend Dr. Lester Grinspoon from Harvard and Dr. John Morgan from the City University of New York Medical School, and many other authors and activists from NORML, growers and activists for cultivating hemp and its many medicinal and non-medicinal uses. And like our guest tonight, I remember Dr. Lester Grinspoon both for his early pioneering work on the benefits of cannabis, but also for his sense of humor. By the way, I was rereading his file in preparation for tonight's interview, and I came across his thank you letter that he wrote. We sent him some books and some other stuff, and this is what he said. The item that impressed him the most was a pair of replica John Lennon sunglasses. He wrote that he was worried that they made him look too much like John Lennon, and he, quote, had best not wear them in a crowd lest he got mauled by adolescent girls. Well, ha-ha to that. Tonight, we are joined by another advocate with a sense of humor, Dr. Joel Meshulam. Dr. Meshulam has practiced internal and geriatric medicine in Baltimore for over 25 years. He completed his undergraduate degree at Rutgers University in 1982 and went directly to medical school at New York Medical College in Valhalla, New York. Upon graduating with his MD degree in June of 1986, he started his residency at North Shore University Hospital and Memorial Sloan Kettering Cancer Center. After 3 years, he began in the private practice of medicine. Dr. Meshulam's office is located at Mercy Medical Center in Baltimore City, where he also serves as the medical director of Mercy's Transitional Care Unit since it opened more than 10 years ago. He is also a health coach, an avid runner, a lifelong Oriole fan, and a big fan of live music. A little bit like me. Now, we are talking to Dr. Meshulam tonight because of his knowledge and experience working with medical cannabis for pain relief and numerous other conditions. He is also related to the scientist who first discovered the medical benefits of cannabis in the laboratory, Dr. Raphael Meshulam of Israel. Now, there's a great video about him on YouTube right now that's been playing for days called The Scientist. Please go check it out. Welcome to 21st Century Radio, Dr. Joel Meshulam.
Thank you, Bob. Call me Joel, please. It's just much easier to pronounce.
Sure. Joel, well, thank you so much for joining us tonight. How about you start telling us about your background, what you do, where you work, and what led you to become an expert in medical cannabis?
Well, first of all, I want to caution you about calling me an expert, but thank you for the kind words. I think you pretty much told everybody already what I would necessarily be saying about myself. I do regular medical care in an office. I've been doing that for 30 years here in Baltimore. I am actually no longer the medical director of Mercy's Transitional Care Unit. I resigned that post at the end of last year. But I do regular medical care. I see patients every day of the week. I do medical leadership with a large medical group called Privia Medical Group. And, as you mentioned in your introduction, I also do cannabis consultations and care with patients who are looking for that as an option for whatever health problems they think may respond to medical cannabis. So I've been doing that for only about 2 years. I came to this through my uncle, actually, who I've admired and loved for my entire life, my dad's younger brother. And actually, if anybody watches The Scientist, if you search that on YouTube, the first thing you'll get is the Coldplay video. But if you search The Scientist documentary, you'll find it's about my uncle. And about 17 and a half minutes in, you'll see some very nice pictures of my father and my uncle on a horse. And then a really great picture that my family loves of the first time my uncle beat my dad in a game of chess. And my uncle has this very satisfied glint in his eye, and my dad is staring at the board, wondering how it possibly could have happened. It's a great picture. So I mean, that's how I came to it. I came to it because my uncle was always, the guy who discovered THC, and in high school that meant one thing, but now that I'm a physician, it means something totally different.
He is such a wonderful fellow. I don't know him, of course, but after watching it about a dozen times and seeing how he works with people, and he's just lovely. He really is. He's a very advanced soul, in my opinion, if you don't mind my saying.
Not at all. I've always thought he was, very, very charming and very, very intelligent and brilliant. And, he talks about my cousins, his grandchildren, and they're all fantastic people also. And we love going to visit in Israel and seeing them. And, occasionally when they come to the U.S. to see us, or usually for my uncle, he's being honored at some, conference or something like that. A few years ago, he was at CanMed in Massachusetts, at Harvard, and then more recently he was in Pasadena for the conference and was discussing. This was last year, a new group of molecules that he's co-developing with another company. So he's still very active. He's still researching. He's still exploring. Still theorizing many wonderful things about the endocannabinoid system and physiology and chemistry. He's just his boundless intellect, boundless curiosity, as you would expect in any accomplished scientist.
Well, he's truly impressive, and he obviously shares his knowledge freely, helps so many other people. Wow, you're very fortunate, and he's very fortunate too. You guys are a good pair there.
It's kind of you to say so. It's interesting. He and I share the same birthday.
Oh, really?
Exactly. Yeah, he's exactly 30 years older than me. We were excited because this coming November we were hoping to celebrate his 90th and my 60th birthday together. But with the current situation with the pandemic, I couldn't take a chance of bringing anything that would get him sick. So we had to cancel that plan, sadly. But yeah, he has a special place in my heart and in the heart of my brother and my sister and our entire family.
Is he the only one in your family that's studying cannabis besides yourself?
Well, I'm sort of being a doctor. I'm not really studying it other than in a clinical perspective. But yeah, he's the guy in the family. This was his niche, and he has pursued it relentlessly since the early '60s.
Whoa. Well, was it your uncle, who took it to the next step in the research and discovery of the human endocannabinoids system?
Yeah, he first started with with hashish and extracted all the various compounds from that and identified their chemical structures, and then started thinking, well, why does this work in the human brain? I mean, we didn't get born with brains that would respond to plants. There must be something in the human body that actually does something that is mimicked by the compounds in the plants, and that's a brilliant thought. And that's what started the second phase of his research, which is, okay, now we know what's in the plant, but we still don't really fully understand why it does what it does in human beings. So let's work on that. And he was fortunate because he surrounded himself with a lot of gifted scientists, a lot of gifted researchers who were of like mind, and together they were able to find some answers about how that all works and how the endocannabinoid system works. He is very, very humble about his the people that he has worked with, and gives credit where credit is due.
Absolutely, absolutely. Geez, oh whiz, boy, it's truly impressive. I remember when I tried to talk to you about this when we got together in person, and I didn't realize that. I was so happy that he was still alive. I was afraid he passed on or something.
No, he's still working. He still sneaks out to his lab from time to time. He's been under, they've been sequestered in their apartment, my aunt and my uncle, for months now. But my cousin, when we spoke on the phone a week and a half ago, said that he snuck out to his lab once or twice during this time. So hopefully nobody will reveal that secret to my aunt. I'm sure she'd be very upset about that.
Well, no one would tell him that. The human I'm not going to mispronounce this, endocannabinoid system. Tell us, what is it?
So the endocannabinoid system is a fascinating ancient system in humans, but it actually transcends humans and is present throughout the animal kingdom and even in smaller organisms that you wouldn't think of as fully developed. And all these species have either a fully developed endocannabinoid system or rudiments of an endocannabinoid system, which tells us that obviously it's very important and also that it's very ancient since it goes throughout the phylogenetic tree. And the system it's throughout the human body. It's in your brain, your heart, your lungs, your gut, your reproductive endocannabinoid system, your autoimmune system, but not in your brainstem, which is incredibly important because that is what my friend Dustin Sulak refers to as the divine brilliance of nature, because what that means is you can't die of a cannabis overdose. We have opiate receptors in our brainstem where our respiratory center is. If you consume too much of that type of compound, you stop breathing and you die. And that's how opiate overdoses happen. But it's impossible to have an overdose from the cannabis plant. This system acts to be a protector, if you will. It maintains homeostasis in the human body. It is typically not active. It activates when needed. And when not needed, the system is quiet. So if I were to, say, fall and hit my head and knock myself unconscious, that's a potent signal for the system to activate to reduce the damage to my brain. And then once my brain is back to its semi-normal state, the system goes quiet again until the next potential upheaval in my body occurs. It is extremely important in pretty much all human disease. And dysfunction and underperformance of the endocannabinoid system can lead to a large array of diseases. Many of them, I'll name just a few, would include rheumatoid arthritis, sarcoid, lupus, irritable and inflammatory bowel disease, cancer, PTSD, pediatric seizures. I mean, just the list goes on and on. So the system is very important. It's a very protective system. And when it doesn't operate as it should be, it can either lead to disease or make disease worse.
Well, why does it stop working?
Well, so when I meet with patients, I talk to them about diabetes. You know, we all have a pancreas that makes insulin. Like the endocannabinoid system, it's quiet until we eat a meal. We eat a meal, our sugar level goes up, which signals the pancreas to make insulin, and our sugar comes back down. But in diabetes, our sugar keeps climbing. Our pancreas gets more and more tired until you start to feel sick. You go to see the doctor, and the doctor tells you, "I'm sorry, Dr. Bob, you've got diabetes, but the good news is we've got these medicines that we can give you that will bring your sugar down to where it belongs." So similar to a diabetic who keeps eating chocolate bars and doesn't really listen to the doctor, in a person, let's say, who has chronic insomnia, anxiety, irritable bowel disease, cancer, these are all huge disruptions in the human being that are a constant demand on this system that can't quite keep up and ends up kind of going quiet, which leads us to the cannabis plant that has compounds in it that when used can mimic the effects of this system and get it active again and help to reduce pain, reduce stress, reduce insomnia, and so on and so on. So the question is, in some illnesses like pediatric seizures, there's an absence of endocannabinoid function. And so these poor children seize and seize and seize, and you give them cannabidiol and they start to have less seizures. But the other arm of that is from constant demand, the system can kind of fail. And that leads us to the use of cannabis to potentially bring activity back into the system to reduce pain and some of the other things I mentioned.
Oh, thank you very much. I know we got to take our first break here. Is that right, Boss Lady? Boss Lady says we got to do it, and that's rules and regulations of 506 of the Penal Code, and we never break that code. Our guest is Dr. Joel Meshulam, MD, cannabis and CBD as medical options for a variety of conditions. Watch the documentary, The Scientist, on YouTube. That's Joel's uncle. You'll love watching him. And find Dr. Meshulam's website's linked on the front page at 21stcenturyradio.com, and you can reach him by phone or for appointments or information at 410-659-7041.
Hello, I'm Sue Carter. I do research on oxytocin and social bonding and the biology of monogamy. You're listening to 21st Century Radio with Dr. Bob Hieronimus.
Sue. It's been a long time since Sue was with us on 21st Century Radio. Welcome back. Our guest is Dr. Joel Meshulam, MD, cannabis and CBD as medicinal options for a variety of conditions. Well, Joel,
Yep.
can we detail here the prime indications for use of medical cannabis such as pain and anxiety, insomnia?
Sure. Where do you want to start? I mean, I
Let's
get
start
a
with
lot
pain.
of patients who ask me questions like, does cannabis help with, fill in the blank? And usually the answer is it may, but it likely won't cause you any harm. But it may not. Cannabis doesn't work for everybody or for everything. That's a fact. But you tell me, which do you want to talk about first?
Pain.
So pain's a very complex thing. Cannabis is an interesting compound. It works in synergy with opioids and actually reduces the amount of opioids you need for pain. In fact, you can co-administer cannabis with opioids to reduce the dose of opiate that you need to establish the same degree of pain relief, and in doing so, reduce the likelihood of an overdose or death. I have patients that have actually used a cannabis protocol to gradually wean themselves off of opiates. I would refer anybody interested to, again, I mentioned him earlier, my friend Dustin Sulak's website. Dustin helps to run a company called Healer, and his website is very simple. It's healer.com, and there's a great lecture and slide deck on the use of cannabis to reduce the necessary dose of opioids and help people to get off of opioids. Additionally, people who are chronically struggling with pain, it becomes sort of their entire world. Think of a shade that comes down over your eyes, and that's all you see. Cannabis definitely has a bliss-inducing effect in many people, not everybody. And so just by maybe giving the brain a little bit of oxygen, lifting that shade a little bit, it allows you to see that there's other things outside of your pain in the world. It sort of liberates you and allows you to integrate a little bit more with your environment instead of having your environment be solely your pain. Again, not everybody gets miraculous benefit from cannabis. I have had some patients who, with the use of cannabis, are able to get off of their antidepressant medications, and they sleep better and they have less pain. And so, it's not unheard of that I have patients that aren't taking some of their medications that they were once taking because they just don't need them anymore. So it can be very, very effective and have a good, robust benefit in pain. And even if it doesn't necessarily eradicate pain, I think most chronic pain sufferers, if told that they could utilize a compound in a variety of different ways that might reduce their pain by 20, 30, 50%, they'd jump at the chance to try it, especially if you told them that it wouldn't kill them.
Oh, yes. And what about anxiety?
Well, it's the same kind of thing. I think anxiety, the whole spectrum of anxiety and PTSD, insomnia, they all sort of travel together. And the person who's not sleeping, who has anxiety, develops even more anxiety. And so the use of THC for PTSD, for instance, can be quite effective. One of my patients is a retired naval commander who was on numerous missions on land and was not sleeping at all until his son gave him a small chocolate that had 5 milligrams of THC. And he told me it was the first restful night's sleep he had in perhaps 12 or 13 years since serving.
Oh, my.
Yeah, it's pretty incredible. And the other thing is that what I have found is that there are a lot of patients who come to me with anxiety have anxiety about cannabis. And so there's a little bit of a work that needs to be done to reassure patients that it is safe, and also to try and explain to them that they need to be patient and not be in a big hurry to find the right dose, because it takes time to do that. Many people who don't do well with cannabis, I think, don't do well because they're in a big hurry. They want to get better yesterday. And so when they don't see immediate benefit, they quit. But I've had very, very fortunate, beneficial results using cannabis in anxiety, for sure.
What about insomnia? How does cannabis can really help with insomnia?
Well, yeah, I mean, it's sort of the same. Again, as I mentioned earlier, it's kind of the same spectrum as anxiety and PTSD. The sleep. So if your sleep cycle is disrupted and you're not getting good sleep, that's a stress on the body. And again, if you're chronically struggling with insomnia, that's not a normal endogenous state. And so your endocannabinoid system might try to fix that until it can't. And so using small amounts of THC and CBD can really help to restore sleep. I generally like using it in a sublingual preparation. My uncle's documentary talks about the use of sublingual THC in small children struggling with cancer to mitigate the effects of the chemotherapy that they're receiving. That mode of administration is highly effective and highly efficient and doesn't require large doses to get pretty nice response for things like anxiety and PTSD and insomnia.
Well, I especially love hearing him talk about that situation, especially with the children, in the sense that things really can be done for them. It's just that obviously people need to be educated about this entire. What about cancer? Can cannabis do anything with cancer?
Well, CBD and THC both have anti-cancer effects. There are a variety of ways that it does that. One of the things that happens in cancer is the cancer grows and it has to have its own blood vessel system to feed it blood and oxygen to keep it growing. CBD and THC both interrupt that cascade of effect. It inhibits the formation of new blood vessels in cancer. Cancer also makes compounds that allow it to migrate to other areas of the body, and CBD disrupts that as well. So there are a number of really, I can't quote them, but there are a number of very good scholarly articles on the science of how CBD and THC can interrupt and suppress the effects of not only the cancer, but the therapy that's being given to treat the cancer. I have a friend in California who is very devoted to and focused on heightening awareness of the use of cannabis for cancer. It's his big project that he works on. His name is Justin Kander, Kander. I'm sure he would love the shout out. So this is not there are numerous stories that you'll see if you watch documentaries about people having miraculous benefits from cannabis when it comes to their cancer, and I don't want to promote that it's the cure to cancer, far from it, but there are a significant number of case studies where you just sort of scratch your head and say, how is this possible?
Yeah.
So it's not magic. It's real, and It's not everybody. Cannabis does not work for everybody, and it doesn't cure cancer, not all cancer, but it can really make a difference in some.
Now, let's get a little bit practical here and talk about the medical uses of cannabis. How can it be used? Are we talking about smoking joints?
Well, so there are different ways to use this. Certainly inhalation is the most immediate and active method because you have lots of blood vessels that course through your lungs. And so when you inhale the active compounds from a plant or an oil from the plant, it rapidly distributes into your bloodstream. So it's like an IV dose of medicine. It hits quickly and dissipates quickly. So for acute pain, severe nausea, anxiety attacks, it can be very, very beneficial. But the problem with inhaled cannabis, number one, it doesn't last very long, so it's not really workable for most people to use an inhalational dose of cannabis throughout the day. They have to work, they have to go to school, whatever the case may be. Another method is ingestion, which is, eating cannabis. So, many dispensaries have cookies and cakes, but there are tablets and liquids that can be used as well. I'm not a big proponent of ingested cannabis, principally, as a physician. It takes a very long time to act. It's very erratic. And therefore it's hard to dose. The other issue with ingested cannabis is it's very inefficient. In other words, if you ingest a dose of cannabis, you're only going to get about 15% of that dose. The rest is wasted. And so patients go to dispensaries and they pay cash for this medicine, and they're paying $1 for 15 cents worth of medicine. Now, having said that, I do have patients that take a tablet of CBD and THC, say 3 times a day, and they feel great. So I'm not here saying that it doesn't work. It's just not typically what I go for. I have another patient I can think of who has cancer. His wife buys flour, makes butter. I don't know how to do that, but I know you can easily figure that out going on the web, where you can figure out all kinds of great stuff. And she makes her husband cookies and brownies, and he eats one a day, and he has no symptoms from his cannabis. He just, looks forward to that once a day. That's all he has to do. So it's a really low dose, really robust effect. I mentioned sublingual, which means under the tongue. Those are tinctures that are available and can be made as well. Highly efficient, easy to dose. The onset of activity is anywhere from about 30 to 60 minutes. Peak effect, 2 hours, lasting 4 to 6 maybe. So you can expect that you could use a sublingual dose every 6 hours, maybe first thing in the morning, late afternoon. Very discreet. You put it under your tongue, couple of drops. Some people need more, but you can gradually adjust the dose upward. And it gets 100% absorbed. So you're getting all of your money's worth, and you can really get a really robust and beneficial effect with a very low dose. And I give patients, a protocol to follow that they can gradually increase that dose until they find the right dose. And then the last thing that I think, that I talk to patients about is there are topical balms and salves that can be applied locally to isolated areas of pain, say a painful wrist or knee. You can use that 3-4 times a day. I've had a mixed benefit amongst my patients. Some sing the praises of a topical preparation, others do not. I have patients with diabetes and neuropathic pain that utilize a topical on their affected areas, and they see benefits. So, I usually list all of these options for my patients and talk to them about each of them, and then I'll give them some direction in terms of what to look for when they go to the dispensary. But the biggest thing is that we're all wired differently. So what works for you may not work for your friend. And it's important to be open-minded and to be patient, because a lot of times a very low dose of medicine can give you a real benefit. So be patient. Most people that I see have been sick for decades. And so I explain to them, you're not going to unwind this in a couple of days. It's going to take weeks or even months to find the right dose, to find the right combination. When we treat with Western medicine, say Tylenol, the only variable is the dose. You can increase the dose of the Tylenol. Beyond a certain dose, it's toxic. With cannabis, it's a multitude of compounds in the plant, a multitude of different ratios of tinctures that you can utilize. And so you really have to pay attention to what you're doing. That's how you have the best chance of success. So I really, really try to stress to my patients, take notes about what you're using, keep the labels so if something doesn't make you feel good, you don't want to buy anything like that again. And if something is seemingly working, stick with that. Stay in your lane. That'll keep you feeling good.
Oh, thank you on that. So there's 4 different ways: inhalation, ingestion, and sublingual. I didn't know anything about the sublingual. And that's a very well-known methodology. There are others. I mean, people can sometimes use in people who are very sick, they sometimes use suppositories. I don't usually recommend that to my patients. They're not looking for that kind of thing. But those are the main ones. Inhalation, ingestion, sublingual or under the tongue, and topical on the skin. Yeah. Well, with all the stigma attached, how can we approach using cannabis as a medicine?
Well, I think the first thing is education. So people are rooted in the reefer madness psyche that was, left at our feet. I don't know, maybe 80 years ago. Or no, it was 1930s, right? So what was that? Yeah, 80 years ago. It's been a long time. Wow. And so it takes time for people to get past that whole ingrained belief structure. And the other thing is that many doctors, this is a brand new thing, the endocannabinoid system. It's not been taught in medical school. I certainly was not taught this in medical school. And even now, doctors not many. There are some programs that are now teaching this. Harvard has a cannabis syllabus as part of their pharmacology teaching. So it's really important, when I'm taking care of patients for any problem, if I don't know, I tell them I don't know. With doctors, when it comes to cannabis, they often stigmatize it further, which leads patients to think that it can't be used. So I think it really is just a matter of hopefully getting more physicians and care providers knowledgeable about the benefits of cannabis. And if they're not comfortable with it, not necessarily telling their patients, oh, it doesn't work, but just say, I don't know. Let me see if I can connect you with somebody who does. That's what I do with my practice. If I have a patient that comes to me with a problem that I don't understand, I'll tell them I don't understand that. I'll do some research. Maybe I can find you somebody who has expertise in that, as opposed to just saying to my patient, if they say something to me that I don't understand, many doctors will say, well, the patient must be crazy because I don't know what they're talking about, as opposed to just saying, well, I don't understand. So let me see if I can find some help for you to get somebody who can.
Well, I do understand we have to take a break right now here on 21st Century Radio. Is that right, Dr. Kortner? Yes, she says yes, so it's got to be. Here, our guest is Dr. Joel Meshulam, and he'll be back here to talk with about some complexities involved that mean that this is not a we've already talked about that, I think, fits all solution. Well, time out here on 21st Century Radio.
Hello, everybody. This is Graham Nash. Right now, you're listening to 21st Century Radio with my friend, Dr. Bob Hieronimus. We need people that are putting the truth in front of our faces. We need leaders. We need great voices on the radio. Dr. Bob is one of them.
Well, there he goes. Welcome back to 21st Century Radio with our guest, Dr. Joel Meshulam, MD. Please watch the documentary, The Scientist, on YouTube. That's Joel's uncle. You'll just love him. And also reach him by phone for appointments or information at 410-659-7041. I think you got that correct. That's correct. Yes. Are you with us, Joel?
Yep, I'm still here.
Okay. What are some of the complexities involved that mean this is not a one-size-fit-all solution? I think you've touched on this a couple of times.
Yeah, I touched a little bit on that. I think so. First, you start with the host, right? The human being or the animal or whoever's being treated with the compound. We're all unique. We're all wired differently, and so that's why cannabis does have side effects in some people. It can cause anxiety, paranoia, psychosis. There are patients who have a sense of their heart racing when they use cannabis. So the point though is that we're not all the same. And so if 5 people sat down and used the same exact type of cannabis medicine, same exact dose, 2 might feel a little bit of something, 1 might feel nothing, 1 might feel terrible. And when I was alluding to earlier is it's not just the host, it's also the medicine, right? So, you give 5 people the same medication. It may work in some, it may not work in others because the medicine itself is not effective. And with cannabis, we talked a little bit about CBD and THC. Well, we haven't. Cannabis has CBD and THC in it, cannabidiol and tetrahydrocannabinol, but it also has a host of other what are called lesser cannabinoids, and they're called that not because they're less medicinal. They're very medicinal, but they're just there in smaller amounts. And then the plant also has plant compounds like terpenes and flavonoids, which affect its medicinal impact on somebody using the plant. So it's not just one thing in the plant that you're using. You're using a multitude of things. So it really becomes very complicated in terms of finding the right dose, the right way of using the medicine, the right method for administration of the medicine. And so the typical situation I think that people get into is, for those who are really looking for a medicinal benefit, the first question is, am I going to get high? Because not everybody enjoys the psychoactivity that they get from THC. They want to be feeling better, but they want to be functional. And so, I have to explain to them that, yes, you can use all of these compounds without psychoactivity. You just have to give your body a period of time to get used to them. But in terms of getting a true therapeutic benefit, a person has to take their time to find that lowest effective dose, because with any medicine, you don't want to use too much. You want to use just the right amount. And so if it's not working, then you have to go on a little bit of a fact-finding mission to figure out why it's not working. Maybe you need to increase the CBD, which is the non-psychoactive major phytocannabinoid, the plant-based cannabinoid. Maybe you need more of that and less of the THC, or the other way around. I have a patient that has a paradoxical effect where CBD gets him psychoactivated, makes him high, THC does not. So there's a lot of strangeness to the cannabis plant that isn't highly intuitive. So it really just takes patience and guidance. So you go to the dispensary to find out, okay, what should I buy? And the dispensary attendants, some of them are very knowledgeable and can be very, very helpful. Some are not. So I always tell my patients, you should be educated about what you're doing. So I'll give them resources to learn more, and I make myself available to them to ask questions. Again, there are dispensaries that I know where the attendants are trained and skilled. I've not been to all the dispensaries in Maryland. Obviously, there's so many of them. I've only been to a handful. But I definitely feel that people have patience and they want to work with their patients and help them to get better. Mm-hmm. And then the elderly, you have to be even more careful, because the plant can make people unbalanced and make them feel a little unsteady on their feet. So you have to go extremely slowly in elderly patients, because you just want to make sure you're not causing them any toxicity or putting them at risk. So it's not simple, but it's not impossible.
Well, CBD, what does it stand for?
Cannabidiol.
Cannabidiol. Okay, thank
you.
All right. Now, if someone is interested in the medical benefits of cannabis but doesn't want to smoke, is CBD alone a solution for them?
Well, CBD, many patients that I have who, in Maryland, the dispensary system is such that you have to apply as a patient at the Maryland government cannabis website. Once you do that application process, it takes anywhere from 2 to 6 weeks for you to get your patient ID number. Once you have that, then the doctor can certify that patient to go to the dispensary. But until then, they have to wait. And so I often suggest for patients who have pain, cancer side effects, things like that, to go ahead and try CBD. The thing you want to be careful about is there's a lot of snake oil out there that says it's CBD. So you really want to do your research and make sure that you're buying the CBD from a reputable source and that it is what it says it is. But yeah, CBD can have really, really impressive effects without any psychoactivity in terms of reducing pain, inflammation, relaxation, calming. I mean, I tell my patients that CBD is not psychoactive like THC. It doesn't make you high, but it is psychoactive. It definitely acts in the brain. It reduces anxiety. It reduces inflammation. So, definitely you can utilize CBD in the same ways. I mean, there's CBD tablets and there's CBD oils that you can buy. You don't have to necessarily go to a dispensary to get CBD oil. Many times you can buy it online from reputable companies and utilize that. The dose, again, varies based on what it is you're treating. So if you're looking to treat seizures or cancer, you want to push the dose a bit higher than if you're using it for other reasons.
Why have there been so few scientific studies on the efficacy and safety of cannabis?
In humans? There have been lots of them in animals. There haven't been too many in humans, and I think that's something that drives my uncle absolutely crazy. I think there are a couple of reasons that I can think of, and there's more going on now in humans, honestly. But in this country, where we have cannabis as a Schedule I substance, meaning it has no medicinal benefit whatsoever. It's in the same category as heroin. And so for many years, the only cannabis you could get was one grow of cannabis from the University of Mississippi, which is very low in THC. So if you're doing research on cannabis, you really need to have a spectrum of different things that you can look at. And having only one cultivar that becomes the source for your research is probably not the best way to do science. And it's has been hard to get approval to do research of any kind in this country. There's more that goes on outside of this country. Now, that's gotten a little bit more liberalized lately, because you now have more than half of the states that have it medically legal, and then a fair few that also have it adult use or recreational. So I think that time is passing now, and you're going to see more work that's being done in human beings. There's a lot of great animal studies out there.
I hope so. How does someone go about becoming certified as a patient with Maryland Medical Cannabis Commission? You talked a little bit about that earlier.
Yeah, so there's a website. It's MMCC, Maryland Medical Cannabis Commission.gov. So if you go into your browser and just type in the letters MMCC, the first thing that comes up is MMCC portal and then patient registry. But you'll see maybe 3 lines down the Maryland Medical Cannabis Commission. If you click on that link, you'll be taken to the homepage, and you'll see various places where you can click to become a patient or a caregiver or a recommending provider. There's a tab there for finding dispensaries as well. Mm-hmm. So if you're looking to be a patient, you click on that tab. There are patients that I have that are too frail to go to the dispensary on their own, so they need someone to go for them. That's the caregiver category. So that if you need somebody to help you go to the dispensary, you would register as a caregiver.
Okay.
It's not that complicated.
Right. Is the cost of medical cannabis covered by insurance?
Not at this stage of the game, no. And so because it's still federally illegal, most insurance companies look at it as experimental, and therefore they don't pay for it. So you're paying cash for this medicine when you go to the dispensary. So no, it's not covered by insurance. In my own practice, I don't accept insurance to do these consultations. My fear being that, let's say I see a Medicare patient and I certify them for cannabis and bill Medicare, and then I get my chart audited, and Medicare says, "Oh, Meshulam recommended cannabis to Hieronimus, and he's a Medicare patient. We're going to prevent Meshulam from seeing Medicare patients any longer." I can't have that. I can't be unable to treat Medicare patients in my practice. So that's kind of my little bit of anxiety in terms of using insurance to bill. But if and when this becomes federally legal, then I really think insurance companies will be obligated at that point to start looking at it differently. There is one medicine for pediatric seizures that's called Epidiolex that is covered by insurance, but you have to jump through hoops and do back handsprings in order to get it approved. It's very difficult to get because it's still very expensive.
How are the synthetic cannabinoid medicines like Marinol different from cannabis?
Well, they're made in a lab, and I think if you look at dronabinol or Marinol, I use that in some patients for appetite stimulation and also for nausea. I don't have a full understanding of why, but cannabis itself is just better. It's more medicinal. My uncle in the mid-90s kind of came up with this idea of the entourage effect of cannabis, which is something along the lines of if you use the whole plant and all the medicine in the plant, it seems to have a more robust and beneficial effect than if you use one element alone. And so if you use CBD alone, it works pretty well. If you use CBD with a little bit of THC, it seems to work better. So just pure THC in a synthetic form is medically legal in this country for certain classes of patients and is paid for by insurance. But it has some benefit, but I don't find it in my practice to be as beneficial.
Well, one other thing here. Can you be a registered and certified legal medical cannabis patient and also be an employee for a company that requires drug testing?
It's a fantastic question. And I have patients that ask me this, and it really becomes a problem for these patients, and they end up trying to make their own decisions in that regard. I've never had a case where a patient works in a company that does drug testing, that tests them, finds them positive, and then fires them. I know that you can take opiates and legally work in many places, but not cannabis. So my only answer to that is what I tell my patients, which is you have to make this decision for yourself. if it comes up or if there's a problem, I would certainly advocate for you and, write you a letter saying this is prescribed under supervision and is medically necessary. But if there's no way for me to predict what a particular employer will or won't do.
Well, I want to thank you for joining us. Joel, you're just fabulous. You're just like your uncle.
Hardly. Trust me, hardly. But thank you. It's very kind of you to say that.
No, but you're dedicated to helping people. That's basically what I was trying to say. And I have 9 doctors that work on my body. And it's so good to talk to someone that has the kind of consciousness that you have. Thank you very much for joining us. And we are talking to Dr. Joel Meshulam, MD, and we're on a mission from the King.
Stay connected with stimulating talk and breaking news on Talk Radio 680 WCBM, Baltimore, and WCBM.com.